And the hits just keep on coming. Dave Temple here at SIROWORLD 2016. Welcome back. We've got quite the lineup today. I'm going to call him, I've given him a nickname now, the godfather of endodontics, Sergio Kuttler.
Thank you.
You like that, right?
Yeah. Thank you.
Rick Yager and Dr. Diwakar Kinra. I'll come up with one for you as well.
Please do.
Yes. I'm going to start out of the gate, Rick, in the world of endodontics. What do doctors want these days? Let's just get right to it.
Sure. As far as an endodontic system,
Yeah.
whether it's an endodontist or a general practitioner, they're looking for a few basic things, and it all comes down to outcomes. How does that system work within the anatomy of a tooth? There's a lot that goes into that. Safety is incredibly important. Flexibility is important. Simplicity of the system is important. Combining all that into something that makes a reproducible, worry-free, stress-free environment is really what we're shooting for.
And how does this relate in the WaveGold system and design, would you say, Sergio?
Basically, it's the metallurgy. With this type of new alloy, the system, the file, it's more flexible. It will have better results in cyclic fatigue, torsional strength, bending. It's far better than the predecessor of this file. And also the simplicity, as Rick said, regarding you only need to use one instrument in 95% of the cases instead of using a gamma of between 5 and 12 instruments to perform root canal therapy.
And I think I said WaveGold. I meant WaveOne Gold because
WaveOne Gold.
Corrected myself. Dr. Kinra, how about, what is your experience?
My experience is, yes, I agree with Sergio and Rick. As far as simplicity goes, that's what I'm looking for also. But one of the best parts of the gold feature, the metallurgy, is I look at a patient, and if I look at them and I can stick 2 fingers in their mouth, that means I can pretty much treat any tooth in that mouth, even if they have a limited access, okay? So one of the beauties of this file is that I can pre-bend it, get it into places where I couldn't before, and that's what gives me maybe an advantage over some of the other file systems that are out there.
And that leads me to another question of you know, I can appreciate the interrelationship between your job and your job. And we've been talking about the specificity of the file being able, the flexibility. Why is that so important? For someone who doesn't understand the flexibility, why is that so important? The gold especially, the gold aspect of it.
Sure, and I think part of it is what Diwakar had said about being able to access, in his particular scenario, being able to access the canal and get into there. From a standpoint of a general practitioner, I think it's more about just knowing that instruments can perform the way they want it to. It's very resistant to breakage, cyclic fatigue. It's very flexible so they can get into tight spaces. And again, they know what the result's going to look like.
In terms of the flexibility, it will maintain the root canal anatomy. It will not deviate. It will not produce procedural errors that what every general dentist and even endodontists are afraid of.
And what I like about it is that I'm looking at the shapes of most of my root canals. And as Sergio said, one file is going to be there to produce most of the shapes that we do in our daily life. And I look at that and I say, well, if I already know what the shape is going to look like, I begin with the end in mind, and I go ahead and start with that shape and continue to make it with one file. That reduces a lot of time, procedural errors. The more files you bring into a case, the better chance that you're going to have some type of problem later on down the line.
How long have you been practicing?
I've been practicing endodontics for about 12 years now.
Sergio, how about yourself?
Since '82.
All right. What kind of progress have you seen since '82 to now?
Oh, we will need more than this time. I have gone through stainless steel hand instruments to rotary nickel titanium and now reciprocation. And the movement also plays a big importance with this instrument. It has been shown scientifically. There is a plethora of articles that have proven that reciprocation is better than rotary instruments. You will have less procedural errors.
Same question.
In that same fashion, as Sergio says, to learn an instrument like a WaveOne, a lot of companies are out there selling files maybe online or, and they're not providing the education that comes with it. Really, to learn the WaveOne correctly, you have to learn the way that the file is meant to be used. And there's a specific motion that you need to use with your hands and when you have the file in your hand. So if you're not out there learning that, you're trying to do a procedure that may be overwhelming to you. But once you learn how to use the actual file, not all files are used the same. So you need to go learn from Sergio. He's an expert, as you said, the godfather of endodontics, and I think we should stick with that.
Or were you were getting ready to say something?
No, that's the thing, that people will learn how to perform excellent root canal therapy with a very simplified system, that it will make more even profitable their file. Also, we need to remember that this type of instruments, they come sterilized already. So they are saving time and money by sterilizing an instrument that doesn't come pre-sterilized.
Rick, how do you make their lives easier?
And I think these are all great points. I think we also have to look at the fact that there's so much guesswork taken out when WaveOne is used. I think there's a lot less clinical deviation that has to happen versus a lot of other systems that are on the market. And to Diwakar's point about clinical ed, there's so many different ways that Dentsply supports that, whether it's online courses, whether it's going to see one of these guys, certainly the Godfather or Dr. Kinra, and it's also at a clinical level in the field. My job really is to be out supporting doctors, and that's not something that we see from, as was mentioned, some of these other companies that are just trying to sell files.
As we get to wrap it up, in relationship to how far we've come, as we said earlier, to where we're going, what are some of the advancements that you look forward to? Or, how, better yet said, how would you like to see things progress on any daily basis? Today, tomorrow, within?
Well, one of the things that I would like to add is that from 64 dental schools in the United States of America and Canada, over 32 schools, that's the file that they use to teach the undergraduate students.
Oh, wow.
And the embracement of this technology is because of all this enhancement that has been done in this WaveOne Gold file. And where do I see the future? The future is brilliant. And one of the things that I'm thinking of is nanotechnologies that they are going to be applied in the endodontic field.
Wow, now that's
amazing.
Interesting. Dr. Kinra?
I agree. I mean, where do we see ourselves in the future? I mean, WaveOne Gold is what, a 5th generation plus file now at this point. As you said, where have we come from 1980s to now? We've taken a lot of jumps, but what I'd like to see is clinicians like us to be on the leading edge of technology, not the bleeding edge of technology. So that means that there's a lot of research that's done with this. These are files that have been proven. There's lots of data out there. And I think that before somebody makes something that they incorporate into their own practice, they need to understand it before it gets in there.
Perfect. I hope you like The Godfather, because I think it's going to stick.
Thank you very much.
Gentlemen, thank you for your time. Enjoy the rest of the show.
Thank you.
All right.
Thanks.
Another break, and we'll be back with more Zero World 2016 in just a moment.